call the roll?
Sue Ashton. Heidi Bassford Kirkhoff.
Here.
Julie Kiefer. Here. Lurton Blassingame.
Here.
Ron Durkoff.
Here.
Sandy Kleckel.
Here.
Julie Maslowski is excused. Judy Ritchie.
Here.
Deb Allison Osby. Here. Jean Wallerman.
Here.
Okay, and we'll move on to approving the minutes. Ron goes through with a fine-tooth comb and works with Bobby to get them as much in order. Are there any additions or corrections beyond what we've already done?
Acceptance.
Second?
It's been moved and seconded. All those in favor?
Aye.
Opposed? Okay. Citizen statements, we don't have anyone here this morning. Hopefully, most of them are over at the Senior Expo. So moving on, new business. Does anyone have any new business to bring before us? And actually, Deb, as long as you're here, let's put anything that you might have to report from the council.
Not much. Obviously, we've been dealing a lot with the water bills, and
Yes.
people's excitement about them. And so we've been addressing some of those issues. There's been some confusion, and so trying to work through that. A biggest thing right now is we're headed into budget season, so we've had a lot of budget meetings so far. We started in July, and then it'll really start to wrap up, and we'll have many more meetings now in October. Our goal is to hopefully try to approve the budget come the first Tuesday that we meet in the month.
Okay. Anybody have any questions for her?
Yeah, Deb, do you have any update on the alternate committee member efforts?
Yes, so
Yeah.
we discussed it, I want to say, 2 council meetings ago, and it sounds like from the mayor that was something that she was going to pursue, and she was going to continue on, and I can certainly follow up with her and
Okay.
see, because if I was not mistaken, this was one of the groups that would like to have
Yes.
Yes.
some alternates. Okay.
And we do have someone, actually 2 someones out there that would certainly consider that.
Sure.
It's a good training for them to step up, fill the spots as some of us decide to retire.
And that's essentially the discussion, is there wasn't a council member that was opposed, to doing that, just because I think it helps with citizen engagement. So I'll follow up with Mayor Palmieri and ask her, and also Mark Roloff, how soon that we'll be seeing those, or if that's something that will be coming after the first of the year.
And wasn't there some discussion about bringing youth in as observer participants?
Yeah, it's kind of like through a youth, because there was talk of like youth, having a youth council. And then I think it kind of has gone to more kind of like a youth leadership. I've not been really a part of those discussions, but certainly something that, I know they're talking about.
It would be very informative to the youth, and they would bring some really good ideas to us.
I think the biggest thing was just, trying to coordinate with the schools to allow them to participate. And then depending, because for some, they meet in the morning and during the day, and how does that impact classes? And then again, transportation if it's more of an evening meeting. So I think there were just some logistics that they would have to work out with the school.
Mm-hmm. Okay, well, thank you.
Absolutely.
Anyone else have anything that would be new business? Okay, then moving on, strengthening our partnership with neighborhood associations and other partners. Lurton?
I met with the representatives of the neighborhood associations, mentioned 4 things. One, asked them to make sure their neighborhoods knew about the Senior Expo. I shared with them the pharmacy services that they can, if you have trouble opening the tops, or Walgreens can request prescriptions in large format labels and so on, or audio visual if you need that help. I mentioned the various elements in the elder benefit specialist with Julie Makowski, and gave her number 420-4886 at Bella Vista. And I went through some of the elder abuse and gave them the number if they had any concerns that way, 844-614-5468. So hopefully they will share that with their neighborhoods.
Okay, thank you. Anyone else with anything, neighborhood associations?
Just a point, Mayor Palmieri came to FCC for an adult education before service, and she's a member of the Middle Village. And she was saying that there are times when she would like other people to take up the effort of being the leadership or the sponsor. And I think a number of neighborhoods may have that problem. And it's too bad, because the neighborhood idea is a wonderful idea for helping lots of different ways. And in our concern, the elderly that are there, but all of them. And yet it is difficult to get people that will come in and take the leadership role and attend the meetings and talk about distribution of information and demographics of who's there and so on. So anything the council can do to encourage the neighborhood support, I think that would be wonderful.
Okay, and Pam is actually going to be our speaker for the November meeting.
Oh, good.
So that's going to be really good. And Julie and I have had a couple of discussions of, not everybody attends the meetings, or when they attend the meeting, they trying to take notes fast enough. And she's got some really good ideas that we're going to be talking about in the future, how we can, fitting into our improving of the communication and visibility of services, along with a lot of other information. So as a new member, she's going to add a lot to our committee. So thank you. Improving access to affordable transportation and delivery services for seniors. We had nothing really new to report this month. Creating community design and policy that supports an age-friendly community. Jean?
I don't have anything to report right now.
Improving communication and visibility of available services to seniors. Ron?
Okay, several things. One, Joan Jaworski, who was one of the elder benefit specialists that met with us last week, just mentioned this in passing, but I wanted to kind of highlight it a little bit. And that has to do with the senior care program. That's the prescription drug program in Wisconsin that has been extended for 10 years. And that's the longest extension I've ever seen in my day, and it's a real plus. Just to say a little bit about the senior care prescription drug assistance program in Wisconsin. It's for residents who are 65 years of age or older who meet eligibility criteria, and there's a $30 annual enrollment fee. Co-payments range from $5 to $15. That's for the level 1 individuals. And for those who have had no gap in coverage, it provides more comprehensive and less expensive drug coverage than most of your Medicare Part D plans. Nearly 50,000 Wisconsin seniors depend on this program to help.
Major number.
Pardon?
That's a major number.
It is a huge number. Yes, it is. Let's see. The other thing is this Department of Health Services, State of Wisconsin, submitted an application in June of 2018 requesting an extension of this Section 1115 Research and Demonstration Waiver, which is what we have with the Medicare MCS with the federal government, is known as the Senior Care Prescription Drug Assistance Program. This was submitted, like I said, last December. They extended it till this coming April, and now have really extended for 10 years. So we should be good through December of 2028. So that's a real positive thing. They won't have to be going back and getting that renewed right away. The next has to do with something we've mentioned before, but now they're actually meeting, and that's the kickoff of the inaugural meeting of the Governor's Task Force on Caregiving, and that happened on September 25th. That's part of his Executive Order number 11, And the whole effort to work on strategies to attract and retain a strong direct care workforce. And you see articles in the paper all the time about the need for additional caregivers. It's no secret that our population continues to age, and caregiving is not a highly paid profession, so there's not too many people going into that, and this whole effort is to try and establish some highlight, I guess, of the need, as well as to come up with some strategies to support caregivers and enhance that profession in terms of benefits and pay and so forth. It's a difficult job. Anybody who's been a caregiver or will be a caregiver, you're going to find out how difficult that is. But anyway, they're underway. Another executive order, it's number 39, it created a task force on reducing prescription drug prices. And this is the state of Wisconsin again. And this is something that the Wisconsin Aging Advocacy Network is in support of. Just a little information on this, nearly 9 in 10 older adults report taking at least one prescription medication, and more than 50% of adults 65 and older report taking 4 or more prescription medications, and nearly 1 in 4 adults indicate it's difficult to afford their prescription drugs. That's 25%. So drug costs and other out-of-pocket medical expenses pose a significant financial challenge for low-income older adults, and the addressing this high cost of prescription drug costs will alleviate some of the economic hardship. So that is getting underway as well, and hopefully that will have some impact, at least at the state level.
Any idea when they would reach a conclusion and
No,
take action?
no, they're
Okay.
just getting underway
They're just
with
starting.
that was a announcement on August 22nd. So they're just getting underway. So
And there is
lots to be done.
representation from our area on that committee,
Yeah.
so
So
that's
that's a
always
good thing, yes. And one final thing, and this has to do with the Bennis Act, which we've talked about at a number of previous meetings. It has to do with getting people who are eligible for Medicare Part B to sign up when they need to sign up, which is age 65. Not their full retirement age, which now is 66 for some people, and it'll soon be 67. And if you sign up late, there's a penalty that you live with as long as you're alive. So the Bennis Act, this is at the federal level now, it's called the Beneficiary Enrollment Notification and Eligibility Simplification Act, is what BENES stands for. Senate Bill 1280 and the House of Representatives Bill 2477. Urgently needed to modernize and streamline the Medicare Part B enrollment process. In 2018, it's estimated that 760,000 people with Medicare are paying a Part B late enrollment penalty. And the average late enrollment penalty amounted to nearly 28% increase in their monthly premium. So right now, the base premium is $135.50. So figure 28% more those individuals are paying, and they'll pay that for the long term. So what the Bennis Act would do would be to prevent costly enrollment errors, and the bill would have fill longstanding gaps in outreach and education by directing the federal government to notify individuals approaching Medicare eligibility about basic enrollment rules. It would also update enrollment timelines to eliminate needless breaks in coverage and inform future policymakers on enrollment period alignment. So it would really help people realize, okay, here's my window to apply for Medicare Part B, which is basically 7 months, 3 months before you turn 65, your month of age 65, and the 3 months following. So But a lot of people miss that because they think, well, I won't need to sign up for Medicare, or they don't think about Medicare till they're starting to get their Social Security. Of course, if they're getting Social Security early, they can't sign up yet till they're 65. But at any rate, it's legislation that's needed that'll help a lot of people know when to apply.
Okay.
Okay.
Any questions for Ron? Okay, moving on, discussion and information pertaining to scams targeting seniors. Got something on that also.
Well, probably just to highlight what you're seeing in the papers and on the news, you know, it's soon to be open enrollment period again for Medicare Advantage plans and all of that. People calling, asking just to verify your Medicare ID number.
They've already started.
Yeah, they are. And Medicare or Social Security Administration are not going to call you to verify your Medicare ID number. They know the number. They know your Social Security number, so they're not needing to call you. So if you're getting a call from anyone asking for any of that sort of information, it's a scam, and you need to hang up.
There's also a scam already started regarding the census.
Yes.
And I didn't bring all the details today, but again, be wary of cards that you're getting in the mail, phone calls that you're getting, and when in doubt, check with, your appropriate offices to get that.
It should be your city clerk, I would think, right?
City clerk.
Clerk's office
County
would
clerk.
have information, correct information regarding census. Yeah.
Anyone else have any scams or anything?
Well, I've been hearing about because I've been calling Social Security a lot lately, and I guess we talk about don't respond to emails, don't answer phone calls, but I guess people are now starting to get letters in the mail.
That's a big difference, because Carolyn was telling the refugees, they're not to call you, you'll get something in the mail, but now.
But now they're getting the mail, so just be very careful in regards to what you're, truly receiving, and if you have questions, then take the letter and go directly to your Social Security office.
That mail purportedly being sent from Social Security,
Exactly,
but Social Security is not sending out.
exactly.
Okay.
So if there's any concerns about what you're receiving in the mail, please double check with your local office.
And another one that's been really making the rounds again the last few days is the phone call that you get that appears to be from Spectrum, that they can lower your bill by $100 or more a month, and go through all of this and getting all of your information. And it's actually from a different provider, but when it comes up on caller ID, it does say Spectrum and the appropriate number. So it gets to the point, and I hate to say it, but never ever pick up on a phone call that you don't recognize the number. Wait for the voicemail and even be cautious of that voicemail. You shouldn't have to feel that way, but too many seniors are being taken advantage of.
Yeah.
And I mean, Heidi, with your business, you're dealing with it a lot.
I am.
And some of us, Ron and I, in our working life, we did the same. And so
Sandy, too.
it's not that we're cynical.
Yeah.
It's just that we
You're
tend to be
realistic.
more cautious. Right.
Yeah.
Just
So,
as a side note, it doesn't necessarily apply here, but there seems to also be, for anybody that's listening, scams that seem to be focused on young adults. Rachel is a freshman in college, and a number of others have been getting calls saying that there's, some type of balance that needs to be cleared up, and they need a debit card or this or that. So it seems to be seniors and very, very newly young
Sure.
adults.
and there's also one that's going around, and I believe it's in the Appleton area, where the kids are getting emails of a chance to make money, being a puppy sitter, and Andy is moving to town and needs someone to, and it's actually human trafficking.
Sure.
bait.
Mm-hmm.
So as parents and grandparents, it's important to monitor your, these kids' emails and computer usage. So again, we shouldn't be cynical and afraid to be in the community, but we need to be more cautious. So, okay, do we have anything else? I know it's a very short meeting.
I have
Julie,
a
yes,
couple
yeah.
of things, if you don't mind, just community things. Take away and pass it down. One, I just have a flyer for our women's wellness retreat, which I talked about when I presented, I don't know, July.
Months.
And then just recently, Learning in Retirement has invited Craig Culver to come and speak, and we're going to partner with the Senior Center, the Y, the Alumni Association, Home Care Assistants, to bring him to campus and have him speak. This is during the day, so it's probably a little bit more geared to older adults who have some availability. But it's free and open to the public, so we would invite anyone who's interested to attend. It's Wednesday, November 20th, from 10 to 11:30.
And it's at,
It's on campus at the Culver Center, which was the Alumni Welcome Center.
oh, okay.
And you always have something good going on.
We try.
I heard some good reports about the visit to the fire station.
Well, good.
And there was another one. I have neighbors that are very involved in it, and it's like, it would be nice to have more hours in the day to participate in more of those activities. So that's one thing the university does a great job of, that outreach and continuous learning. And people are enjoying it, and what you're offering is a very wide range of information and education. So thank you for doing such a good job.
Julie,
It's
people,
volunteer run, so I can't take very much credit.
You make it happen. Without them, they're the staffing. So,
people do need to register, though, according to this, right? For the,
Just for planning purposes, right now I
Sure.
have one portion of the ballroom reserved, but if we get enough, I would
Oh,
reserve
okay.
more space.
Mhm.
So that's really the major reason.
Okay, thank you.
okay. I did have one piece, and I'm going to get some more information on it. I was dealing with my 89-year-old neighbor the other day, and her doctor had gone over the advanced directives, which is done in the wellness and annual visit, and she has her advanced directives done and everything. But he went over the do not resuscitate DNR bracelet or order, and she's very adamant that she does not want resuscitation. She knows the consequences with, if something happens, what could feasibly create more problems than helping. And so the state form has been filled out for the bracelet or for the order. The doctor told her that she could just put that form on the refrigerator and the paramedics would honor that. Well, I spoke with Chuck Hobley this morning because that letter says you have to have the bracelet. And so I talked with Chuck Hobley with the paramedics this morning while we were setting up for the senior expo. And yes, you need to have a bracelet. It does not have to be the hospital band. You can get one of the others, but it's only through, I believe it's Sticky J is the provider that's recognized by the state. And I'll have more information on that next month, which can then be more of a jewelry look type bracelet. But that bracelet needs to be on, and the paramedics will sometimes, depending on circumstance, go by that state letter, that state form. But it's best to have the bracelet.
Does the bracelet have to go on the wrist, or could it go on the ankle?
I don't know. Possibly. I mean, the wander guards that are worn in the facilities are either on the ankle or the wrist. But normally they look for the wrist.
Right.
And I know after my last surgery, I was told that I needed to have a bracelet, and I got one that looks more like a charm bracelet instead of some of the other ones. just 'cause. But it's important to have those bracelets, whether it's the DNR bracelet or the ones with your allergies, because you never know when something's going to happen and you can't respond appropriately. And they're not going to dig in our wallet. They're not going to dig all over to find it when you're in a crisis mode. So anyway, that's something that we'll have more information on in the future. With that, our meeting date next month is November 5th. Our speaker will be Pam Reuter from the neighborhood associations. And I have to thank Julie for making that connection. I did speak with Pam just briefly as I was coming out of a meeting. She was going in the other day, so we've got a couple more ideas of what we want to cover. And she's willing to meet with us on more than one occasion, so that's a good thing. So on that note, I'll take a motion for adjournment.
Okay.
Those in favor?
Aye.
Adjourned. We will head back over to the Convention Center for the expo.